We are having an important conversation this morning as part of Lymphoma Awareness Month, and I just shared that I've been diagnosed with the disease, and my oncologist and leading researcher, Dr. John Timmerman, is here helping us understand more about lymphoma. And now we want to bring in Mary Mathew. She's a therapist from Beyond Cancer LA and a lymphoma survivor yourself, which gives people like me so much hope to see you functioning and thriving. And you know, I just am learning this. This is fresh for me. So what advice do you have for people who recently have any kind of cancer diagnosis and going through feelings of loneliness and sadness and confusion and a loss of control?
The loss of control is definitely something that happens with most cancer diagnoses. We are living our normal life day in and day out, and then boom, this thing happens and everything has to stop and we have to address it. And so the number one thing that I tell my clients is, let's evaluate your coping skills. What are we working with here? What are your internal coping skills and your external coping skills? External meaning, you know, some people will tell me exercise, running, jogging. Well, if I took that away from you, what are you left with? Those are your internal. Whether that's meditation or prayer or reading, those are all great coping skills, and that's what we're going to pull from.
Yeah, so you, and once the shock wears off, how does a patient know he or she needs help, professional help from a therapist?
I think, well, it's a biased, I think everybody could benefit from professional help. It's such a unique experience, and although we're surrounded by friends and family who are well-intentioned and well-meaning, sometimes they simply don't get it, and that's a common experience amongst cancer patients of just feeling like no one understands. So,
reach out for help.
Reach out for help. There's nothing wrong. We're just talking. I tell people I don't have shots. I don't. We're not doing blood work. We're just talking.
Yeah, but it can be scary to kind of open those wounds and to kind of discuss that. And Dr. Timmerman, you were telling me when I was first diagnosed, don't think of this as cancer, don't say the word cancer, this is follicular lymphoma, that's what you're dealing with, and that's how you're going to think of it. And that helped me a lot.
Good, yeah. It is a type of cancer, but when we're dealing with something that's highly treatable, that may not affect your longevity, given all the modern advances, it's important to know that to not use the C word all the time, to understand what you have. This is lymphoma, and to understand that that implies lots of treatments, lots of hope.
Yeah, and I realized just that how important having a team is, how important having professional spiritual help, mental help, having an amazing doctor, having my team here. Why don't you guys come join us? They're standing here in the wings. And often you realize that you actually have more support than you might think.
Yes.
So how do you recommend people get that support and reach out to everyone?
I think, well, first and foremost, don't be embarrassed or scared to disclose to your loved ones what you have. And in addition, you want to be very clear on how they can support you. Sometimes they have no idea.
Sometimes you have no idea.
And sometimes
right?
you have no idea. And so it's an ongoing conversation. Just keep talking. Hey, I'm doing chemotherapy next Friday. Do you want to come in with me? Great. I have a doctor's appointment. Do you want to drive me there? Awesome. Whatever you do, do not cancer ghost. It is a very painful experience that happens to a lot of people in our community.
I never would have thought of that, and honestly, so thank you for that tip. When Rudabeh first told me, I think everyone goes through this when they've had a loved one that they care so much about. You hear the word. I'm glad you put it that way. I'm not going to think about it that way too. You wonder how to best support them. And what are the right things to say? You know, when she told me, it's like, oh, what do I do? How do I approach this? You don't want to go, oh, you'll be fine, or everything's going to be, you know.
Yeah.
Can you explain to people just the best way to deal with something like this?
The simplest thing you can do is do a lot more listening and a lot less talking. She's learning about it in real time and processing all of the information in real time, and so be there and allow her to speak. You know.
Rudabeh, you've been so strong.
Thank you.
I mean, watching you, it's an honor to work with you. You're being so brave, and the fact that you're taking the time out to raise awareness on something this important, it's admirable, and it speaks to who you are. as a person. So thank you for doing this. Also, as she's going through her own process, we also have the side of friends and family who, just like Jamie said, learning how to help, learning how to navigate their own emotions when it comes to a cancer diagnosis of someone that they care about so much, whether it's a parent or a sibling or a close colleague and friend. Do you have any advice or anything you can share with caregivers out there who are trying to navigate their own emotions while also offering support to the person going through it?
Caregivers play such a vital role, and they carry a lot of what's going on because they're living with the cancer patient often, and they're taking in the emotional stuff, they're taking in the physical stuff. Caregivers need a lot of support. My advice to caregivers is don't stop using your coping skills. You might have to readjust them. If you're somebody that runs 6 miles a day, let's try 3. Whatever it is, but just get out there and continue living your life also. Caregiving also looks different for different types of cancers and different kinds of treatments, and so I want to be mindful for that. You know, caregiving is going to look very different for somebody who had a loved one undergo stem cell transplant versus, you know, what you're going to go through. And so we want to be mindful of that, check in with caregivers. How can I support you through this process as well?
You know, I have to say now, having been diagnosed myself, it can be harder to be a loved one who's watching someone struggle with cancer. That can be a harder thing.
That is so you, but that's not.
No, it's. I mean, the emotional impact of that. Like, talk about a loss of control, watching someone you love suffer. Right? So I think that's a very overlooked kind of part of it because people are focused on the patient.
Yes, absolutely.
I think what you said earlier about coming with people to their appointments, I mean, that's when it's good to have somebody there, a friend or a family, to take notes. Doctors talking, sometimes it's hard to listen after important news is given. Sometimes, you know, the rest of the words may not be heard and understood. I always try to take time to write things down, have somebody take notes, clarify that. But having somebody else there just to make sure that the message comes across. It's okay to actually bring your phone. I tell patients, go ahead and turn it on, record a voice memo so that you can listen to it again later.
Smart.
Because sometimes the words will come out and you can't really process all that in real time. It can take multiple times. So I invite those kind of things, and I think it's okay to ask your doctor to doing that.
Yeah, I think when I got the call, it was just like a swirling cloud of like lymphoma, positive, and those were the only words I picked up, and everything else kind of just evaporated, and I couldn't even understand anything because you're going through grief and confusion and shock at the same time. So
there's a day-to-day that we all go through before you would have this diagnosis. There's a day-to-day that you continue to want to do or do after a diagnosis. How important is that? Continuity in your schedule, continuity with your loved ones, that day-to-day routine. How important is that to keep that? Because you want to keep moving forward with your life.
It is very important. We also want to be mindful, though, that sometimes that's not an attainable goal. So we don't want to set ourselves up for failure. When appropriate, depending on the diagnosis and the treatment plan, absolutely, we're going on, we're moving forward. For other treatments, we might need to pause and reassess what is it that is important and prioritize those things and move forward in that way. And remember that for a lot of people, this is a temporary time in their life, and that hopefully they'll be on the other side.
Yeah, I agree with that, Mary. That's really important to keep your life moving. As you said, sometimes there are more unusual cases where things are so serious you really need to pause work. But for most patients with lymphoma, they can continue to work, and they should continue to work and live their life. The last thing they should do is to, you know, stay at home, take time off work, and sit around and think about this. They
be alone with your thoughts.
No, that's not a good thing. They should continue to work in their career, pay attention to their family, exercise, do all of those things. What some people say, oh, doctor, can I get a disabled placard? This is one of my.
I was not one of those people.
This is one of my pet peeves. Don't ever ask Dr. Timmerman if you can have a disabled placard, because I tell them I don't consider you disabled. I don't want you to consider yourself disabled. So I'm not going to give you that. If somebody's in very tough shape, they may get that. But for most people, you're not disabled. You have this diagnosis, you have your support team, and you want to continue to work and run your life. Those are the best things you can do to move forward and get through it.
In a way, it almost kind of gives you a superpower as opposed to being disabled, because you do have a different window into life and a different perception, different appreciation about everything. I know that sounds cliche, but it really is true. So Mary, I want to end with you on this message of hope, because everything you've been through, I know it must be painful to relive it every day with your clients, but you've decided to dedicate your life to helping people. So what is your message of hope?
We got to maintain hope. We're living in such a remarkable time where treatments are different and we're moving forward, and there's new things that are constantly being approved. And so hold on to hope. And if you ever lose hope, your support system, you guys are the ones that are responsible to hold on to that hope for her.
Yeah, and I'm so grateful to have all of you and everyone not on camera right now behind the scenes. It really does keep me going. I love coming to work every day. I love what I do, and it brings me a lot of comfort to know that all of you are here, this whole team. So thank you.
We love you.
We love you so much.
Okay, well, we know it can be daunting navigating a diagnosis, so sometimes it's even hard to know where to start. Again, we want to remind you to go to our website. We've set up that resource guide on kcalnews.com. Just go to kcalnews.com/cancer, and we'll be right back.